Picture this. You're sitting in your doctor's office doing everything right, getting your annual checkup, following medical advice, being proactive about your health. Your doctor orders what seems like a routine test. You nod, trust the system, and get it done. But what if I told you that some of the tests your doctor orders could actually be putting your health at risk rather than protecting it? What if the very procedures meant to catch problems early could in some cases cause more harm than the diseases they're meant to detect? Before your next doctor's appointment, you need to know about 3 commonly ordered medical tests that experts now say may be doing more harm than good for people over 60. Stay with me. This could literally save your life or prevent unnecessary suffering. Hello, friends. If you're over 60 or caring for someone who is, welcome. I'm so glad you're here because today we're talking about something that doesn't get nearly enough attention: medical overtreatment. Now, I know what you might be thinking. Shouldn't I get every test my doctor recommends? Isn't more testing always better? For decades, that's what we've all believed. But here's the truth that many doctors are now speaking up about. Not all medical tests are appropriate for everyone, especially as we age. The medical community is increasingly recognizing that certain tests, when performed on older adults, can lead to false alarms, unnecessary anxiety, risky follow-up procedures, and treatments that reduce quality of life without actually extending it. Major medical organizations, including the American Academy of Family Physicians and the American Geriatric Society, have started publishing lists of tests and procedures that are frequently overused in seniors. Today, I'm going to walk you through 3 specific medical tests that you should think twice about if you're over 60. I'll explain why these tests might not be right for you, what risks they carry, and most importantly, what questions you should ask your doctor before agreeing to them. Main content test number 1: routine cancer screening tests for seniors with limited life expectancy. 138. Let's start with perhaps the most controversial topic: routine cancer screenings in older adults. Now, before anyone gets upset, let me be crystal clear. I'm not saying cancer screenings are bad. Early detection has saved countless lives. But here's what many people don't realize. Cancer screenings become less beneficial and potentially more harmful as we age, especially after 75. Why is this? First, you need to understand how cancer typically works in older adults. Many cancers grow very slowly. A prostate cancer or breast cancer detected in a 76-year-old might take 10 to 15 years to cause any actual symptoms or health problems. Statistically speaking, many seniors will live out their natural lives and pass away from something completely unrelated: heart disease, stroke, or simply old age, long before that slow-growing cancer ever causes them a single problem. Here's where it gets problematic. When we screen for these slow-growing cancers in older adults, we find them. And once they're found, the medical system often pushes toward treatment: biopsies, surgeries, radiation, chemotherapy. These treatments come with real immediate risks: infections, complications from anesthesia, incontinence, sexual dysfunction, fatigue, and significantly reduced quality of life. Let me give you a real example. Margaret, a 78-year-old woman, went in for her routine mammogram. A small abnormality was found. This led to a biopsy, which found a tiny, slow-growing cancer. She underwent a lumpectomy and radiation. The surgery led to complications, including an infection that required hospitalization. The radiation caused severe fatigue that lasted months. 2 years later, Margaret's overall health had declined significantly, not from cancer, but from the treatment. Her oncologist later admitted that, given the type and size of the tumor, it likely would never have caused her any problems in her lifetime. What the experts say: the U.S. Preventive Services Task Force now recommends against routine mammograms for women over 75. They recommend against PSA screening for prostate cancer in men over 70. The American Cancer Society suggests that colorectal cancer screening can stop at age 75 for people with negative prior screenings and no high risk factors. These aren't fringe opinions. These are mainstream medical guidelines based on extensive research showing that the harms often outweigh the benefits in older populations. The specific test to discuss with your doctor. Mammograms after age 75. Unless you have a strong family history or previous breast cancer, the evidence shows minimal benefit and potential for harm from false positives and overtreatment. PSA tests for prostate cancer after age 70. These tests have extremely high false positive rates and often detect slow-growing cancers that will never cause problems, leading to unnecessary biopsies and treatments. Colonoscopies after age 75. The procedure itself carries risks: perforation of the colon, bleeding, complications from sedation that increase with age. If you've had normal screenings throughout your life, the benefit of continuing into your late 70s and 80s is questionable. What you should do: have an honest conversation with your doctor about your overall health, life expectancy, and personal values. Ask these specific questions. Given my age and overall health, what is the actual likelihood this screening will extend my life? What are the risks of the screening itself and any follow-up procedures? What would happen if we simply monitored instead of screened? Are there less invasive alternatives? Remember, you have the right to decline any test. You are not being irresponsible by asking these questions. You're being smart and taking control of your healthcare. Test number 2, annual EKG and cardiac stress. Tests for people without symptoms. 8 out of 14 monitor. The second test that's commonly overused in seniors is the routine EKG or cardiac stress test for people who have no symptoms of heart disease. Let me explain why this matters. Your heart is obviously crucial, and heart disease is the leading cause of death in older Americans, so it seems logical that regularly checking your heart with an EKG or stress test would be beneficial. But here's what the research actually shows. If you have no symptoms, no chest pain, no shortness of breath, no unusual fatigue, routine screening with these tests doesn't improve outcomes and often leads to a cascade of additional testing and procedures that carry real risks. The problem with just checking: here's what typically happens. You go in for your annual physical. Your doctor says, "Let's do an EKG just to check your heart." The test shows a minor abnormality, something that might be completely normal for you, or might be a false positive, or might be a tiny issue that will never cause problems. But now it's been found, so your doctor refers you to a cardiologist. The cardiologist orders a stress test. That shows another small abnormality. Now you're getting a cardiac catheterization, a procedure where they thread a tube through your blood vessels to your heart. This procedure carries risks: bleeding, infection, kidney damage from the contrast dye, even heart attack or stroke in rare cases. During the catheterization, they find a small blockage. It's not causing symptoms, but it's there, so now they want to put in a stent. You undergo the procedure. You're put on multiple medications, including blood thinners that increase your risk of bleeding. You might experience side effects from these medications. Here's the kicker: multiple studies have shown that for people without symptoms, stents don't prevent heart attacks or extend life compared to medication and lifestyle changes alone. You've just undergone several risky procedures. You're on multiple medications, and your quality of life may have actually decreased, all starting from a screening test you didn't need. The research is clear. The American College of Cardiology, the American Heart Association, and the Choosing Wisely campaign, a program led by medical specialty societies to reduce unnecessary tests, all recommend against routine EKGs and stress tests in people without symptoms or risk factors. A major study published in the Journal of the American Medical Association followed thousands of adults and found that routine EKG screening led to more procedures but didn't reduce heart attacks, strokes, or deaths. What it did do was increase healthcare costs and expose people to unnecessary procedure risks. Who should still get these tests? Now, I'm not saying these tests are never appropriate. They absolutely are valuable if you're experiencing chest pain, shortness of breath, or other cardiac symptoms. You have a strong family history of early heart disease. You're about to start a vigorous exercise program and have been sedentary. You have multiple risk factors like diabetes, high blood pressure, and high cholesterol. What to ask your doctor? If your doctor recommends a routine EKG or stress test and you have no symptoms, ask, what symptoms or risk factors am I showing that indicate this test is necessary? How will the results of this test change my treatment plan? What are we looking for, and what will we do if we find something? Can we focus on proven prevention strategies like diet, exercise, and blood pressure control instead? The better approach, rather than fishing for problems with screening tests, focus on what we know prevents heart disease, managing your blood pressure, controlling cholesterol if it's elevated, not smoking, staying physically active, eating a heart-healthy diet, managing stress. These strategies have far more evidence supporting them than routine screening tests in people without symptoms. Test number 3. Bone density scans, DEXA scans for certain older adults, 14-20. The third test that's often overused is the bone density scan, also called a DEXA scan, particularly in people who've already been diagnosed with osteoporosis and are on treatment. Now, osteoporosis is a real concern, especially for women after menopause. Weak bones can lead to fractures, which in older adults can be devastating, leading to loss of independence, prolonged hospitalization, and even death in the case of hip fractures. So why am I suggesting that bone density scans might be doing more harm than good? The issue of repeat testing. The problem isn't the initial screening. If you're a woman over 65 or a man over 70, getting a baseline bone density scan is generally recommended and appropriate. The problem is the frequent repeat testing that often follows, especially in people already on treatment for osteoporosis. Here's what commonly happens. You get a DEXA scan and are diagnosed with osteopenia, mild bone loss, or osteoporosis. Your doctor prescribes medication like a bisphosphonate. Then you're told to come back every year or two for repeat DEXA scans to monitor your progress. But here's what research shows. Bone density changes very slowly. A scan done 1 or 2 years after starting treatment typically doesn't provide useful information that changes your management. You're already on treatment, and it takes years for significant changes to show up on a DEXA scan. Moreover, bone density is only one part of fracture risk. 2 people can have the same bone density but very different fracture risks based on other factors: history of falls, muscle strength, balance, use of certain medications, and overall health status. The harm of over-monitoring. You might think, well, even if the test doesn't help much, how can it hurt? Here's how. First, the anxiety factor. Each scan becomes a source of worry. You wait for results, stress about whether your numbers are improving, and focus on bone density numbers rather than on practical fall prevention. Second, the radiation exposure. While DEXA scans use very low doses of radiation, repeated scans over many years add up, particularly if you're also getting other imaging tests. Third, and most importantly, the numbers from DEXA scans often lead to medication decisions that may not be appropriate. Small fluctuations in bone density, which can happen due to normal variation or even how you're positioned during the scan, sometimes prompt doctors to add medications, increase doses, or switch to more powerful and potentially more dangerous drugs. Some osteoporosis medications, particularly when taken for many years, come with serious risks: unusual fractures of the thigh bone, jawbone death, osteonecrosis, esophageal damage, and severe muscle or bone pain. The decision to start, continue, or intensify these medications should be based on your overall fracture risk, not just on minor fluctuations in DEXA scan numbers. What the guidelines actually say: the American College of Physicians recommends that women with osteopenia, mild bone loss, don't need repeat DEXA scans more often than every 10-15 years if they're not on medication. For those on osteoporosis treatment, the Endocrine Society suggests that repeat testing intervals should be individualized, and frequent testing, more often than every 2 years, is rarely helpful. Better approaches to bone health. Instead of focusing on frequent DEXA scans, focus on what actually prevents fractures. Fall prevention. Most fractures happen because of falls. Remove tripping hazards in your home. Improve lighting. use grab bars in bathrooms, address vision problems, and review medications that might affect balance. Strength and balance exercises, Tai Chi, gentle yoga, and resistance training improve balance and muscle strength, directly reducing fall risk. Adequate calcium and vitamin D. Get these through diet when possible. Dairy, leafy greens, fortified foods. Supplements may be needed, but ask your doctor about appropriate doses. Avoid bone-damaging habits. Don't smoke, limit alcohol, and be aware that some medications, like long-term steroids or certain antidepressants, increase fracture risk. Questions to ask your doctor. If your doctor recommends a repeat DEXA scan, ask, how will this scan result change my treatment? Given that I'm already on medication, what specific information are we looking for? Can we extend the interval between scans? Should we focus more on fall prevention and exercise? Engagement moment, 20-second 21. If you're over 60 or caring for an elderly loved one, this information could be life-saving. The healthcare system is designed to do more tests, more procedures, more treatments. But more isn't always better, especially as we age. I want to pause here and ask you to do something. If this video is opening your eyes to a different way of thinking about medical tests, would you give it a quick like? And if you know someone, a parent, spouse, friend, or sibling, who's navigating healthcare decisions in their 60s, 70s, or beyond, please share this video with them. This information isn't widely talked about, and you might be helping someone avoid an unnecessary procedure or helping them ask the right questions at their next appointment. Now, let's talk about what you should do with this information. I know what some of you might be feeling right now: confusion, maybe even fear. You're thinking, if I can't trust my doctor's recommendations, what should I do? Let me be clear, I'm not telling you to distrust your doctor or to refuse all medical tests. What I'm encouraging is informed decision-making and open communication. Here's your action plan. Step 1. Prepare for your appointments. Before your next doctor's visit, write down any symptoms you're experiencing and questions you have. When a test is recommended, don't just nod and agree. Ask questions. Step 2. Use the Ask Me 3 approach. When any test is recommended, ask these 3 questions. Do I really need this test? What are the risks? What happens if I don't get it? These simple questions can open up a conversation about whether the test is truly necessary for you. Step 3. Understand your own priorities. Think about what matters most to you. Is it living as long as possible, regardless of quality of life? Or is maintaining your independence and quality of life more important than adding months or years that might be spent in hospitals or dealing with treatment side effects? These are deeply personal questions, and there's no right answer. But knowing your own priorities helps you make decisions that align with your values. Step 4. Consider getting a second opinion. If your doctor recommends a major test or procedure and you're uncertain, it's absolutely appropriate to seek a second opinion, especially from a geriatrician, a doctor who specializes in the care of older adults. Step 5. Bring a family member or friend. Having another person at appointments helps. They can ask questions you might forget, hear information you might miss, and help you process decisions afterward. Step 6. Focus on what definitely works. While we're questioning certain tests, don't neglect the things we know for certain improve health in older adults. Stay physically active. Even gentle walking makes a huge difference. Maintain social connections. Eat a balanced diet rich in fruits, vegetables, and whole grains. Keep your mind active. Get adequate sleep. Manage stress. Keep up with vaccinations, flu, pneumonia, shingles, COVID. Take medications as prescribed for conditions you definitely have. Imagine some of you might have concerns or objections to what I've shared today. Let me address a few. But my doctor recommends these tests. Are you saying my doctor is wrong? Not at all. Your doctor wants to help you. But doctors are human, and they're working within a system that often defaults to more testing rather than less. Many doctors are also concerned about missing something and facing lawsuits, which encourages defensive medicine. Having an open conversation with your doctor about the pros and cons of any test isn't questioning their competence, it's being an engaged patient. What if they find something serious and we catch it early? That's absolutely possible, and that's why these decisions need to be individualized. For some people, certain tests are still very appropriate. The question is whether the likelihood of finding something that truly needs treatment and will benefit from early detection outweighs the likelihood of false alarms, unnecessary follow-ups, and treatment complications. Isn't it better to be safe than sorry? This is perhaps the most common reaction, and I understand it. But in medicine, being safe sometimes means avoiding tests that carry risks or lead to treatments with serious side effects. Sometimes the safer choice is watchful waiting rather than aggressive testing and intervention. My friend's cancer was caught by a routine screening and it saved their life. I don't doubt that, and I'm genuinely glad for your friend. Cancer screenings do save lives, just not all lives and not always in every age group. The question is always about balancing benefits and harms for your specific situation. Summary 26/27-30. Let's recap what we've covered today. We've discussed 3 medical tests that are commonly overused in seniors over 60. First, routine cancer screenings in older adults with limited life expectancy, particularly mammograms after 75, PSA tests after 70, and colonoscopies after 75. While cancer screening saves lives in younger populations, the balance of benefits and harms shifts as we age, especially when slow-growing cancers are found that would never cause problems but lead to treatments with serious side effects. Second, routine EKGs and cardiac stress tests in people without symptoms. These fishing expeditions often lead to cascades of additional testing and procedures without improving outcomes, while exposing seniors to unnecessary risks. Third, frequent bone density scans, particularly in people already on osteoporosis treatment. Bone density changes slowly, and frequent monitoring rarely provides information that changes management but can lead to medication intensification and anxiety. The key takeaway isn't to refuse all medical tests. It's to be an informed consumer of healthcare. Ask questions, understand why a test is being done, what the risks are, and how the results will actually change your care. Motivational closing 27, 30, 28, 30. Here's what I want you to remember. You are not just a passive recipient of healthcare. You are an active participant in decisions about your own body. Getting older doesn't mean handing over all decision-making to doctors. In fact, it means the opposite. As we age, our healthcare decisions become more nuanced, more individual, and more tied to our personal values and goals. You've accumulated decades of wisdom about yourself, your body, and what matters to you. Use that wisdom in your healthcare decisions. Being proactive about your health doesn't just mean getting every test and screening offered to you. Sometimes it means thoughtfully declining tests that don't serve your best interests. It means focusing your energy and resources on the things that truly improve health and quality of life. Staying active, eating well, maintaining relationships, managing stress, and keeping your mind engaged. You deserve health care that respects your individual circumstances, your values, and your goals. Don't be afraid to advocate for that. If you found this video helpful, please take a moment to subscribe to this channel. I create content specifically for seniors and their families, covering health topics that don't always get the attention they deserve. Click that subscribe button and the bell icon so you don't miss future videos. Also, I'd love to hear from you in the comments. Have you ever felt pressured to get a test you weren't sure about? Have you had a doctor who really took the time to explain why a test was or wasn't necessary? Your experiences can help others who are facing similar decisions, so please share them below. And please, if you have a parent, spouse, sibling, or friend over 60, share this video with them. These conversations don't happen enough in doctors' offices, and you might be helping someone you love avoid an unnecessary procedure or feel empowered to ask the right questions. Finally, check the description below this video. I've included links to resources from the Choosing Wisely campaign and other reputable sources where you can learn more about appropriate testing for seniors. Thank you so much for watching. Take care of yourself, ask questions, and remember, the best healthcare is healthcare that's right for you as an individual, not just what's right for everyone your age. I'll see you in the next video. Stay healthy, stay informed, and stay empowered.